coming in, where the Health Minister Mansukh Mandaviya reviews preparedness for management of COVID-19 and COVID-19 vaccination progress with the states. State health ministers are requested to review preparedness with district administration and public health officials on 8th and 9th April. Well, that is the big breaking news that we are getting you at this point in time, where the central government has sprung into action and without any delay, Health Minister Mansukh Mandaviya reviews the preparedness for management of COVID-19 and COVID-19 vaccination progress with the states. And to get us more details, I'm joined by my colleague Mayank. Mayank, take us through more details about the State Health Minister having been requested to review the preparedness with the district administration and public health officials, specifically on 8th and 9th of April.
COVID-19 cases across the country over the last few weeks. Union Health Minister Mansukh Mandaviya chaired a high-level meeting with the health ministers of all the state, and some of the key observations made by the health minister were about that the number of tests across the country have dipped below the national average, and the focus was on to increasing the number of tests per million, as per the WHO standard, because the word from the health ministry was that the more the number of tests, the better it is to understand the spread of the pandemic at this particular stage. Apart from that, he also urged this all the health minister to take stock of the medical infrastructure situation and to ensure preparedness by 8th and 9th April, for which they will be assessing conditions on 8th and 9th April, just a day before, because on 10th and 11th April there are mock drills planned, the report of which will be submitted to the Union Health Ministry as well. Apart from that, the Health Minister Mandaviya also briefed all the health ministers of the states that the XBB 1.16 is the most dominant variant, and the number of cases of this particular subvariant of the Omicron variant has jumped from 21.6% in February to 35.8%. That's a significant jump that has been recorded from the XBB 1.16 variant, and he also briefed that this is a variant of interest that the WHO is tracking. So India is not the only country where this subvariant of Omicron is spreading very rapidly, and it is it has been informed that this particular subvariant escapes immunity, and that is why these number of cases has coming. But there was also a mention of the fact that we have been also reporting continuously that the rate of hospitalization has not gone up across the country, and that is a good sign for the public. So all the health ministers have been briefed about the research and the analysis that the health minister and the ministry and the top officials of the ministry have done over the past few weeks as the number of cases have gone up, and all the states have been asked to step up their infrastructure in case there any COVID emergency comes up in the country, and for which there will be assessment on 8th and 9th of April by the public health officials and the state health departments. But on 10th and 11th, there will be a nationwide mock drill in both public and private funded hospitals across the country.
Absolutely, Mayank. Thank you for getting us all those details, and we shall come back to you for more updates on this story that we are tracking very closely. All steps are being taken by the central government to ensure that all preparedness and arrangements are put in place in case there is a spike in COVID-19 cases. There are meetings being held with the health ministers of all the states, and consequently, mock drills have been planned later in the week.